What is a lymphoma biopsy? Imagine trying to solve a mystery about what's causing unusual swelling or lumps in your body. A lymphoma biopsy is a key step in uncovering whether those lumps are related to lymphoma, a type of blood cancer that starts in the lymphatic system. This procedure involves taking a small piece of tissue from a lymph node or other suspected area to look for cancer cells. The tissue is examined under a microscope by specialized doctors called pathologists. They check for abnormal lymphocytes or cancerous lymph cells and help determine the exact type of lymphoma. Knowing the specific type is crucial because it guides doctors in choosing the best treatment options. There are several ways to perform a lymphoma biopsy, and the choice depends on where the suspicious tissue is located and how accessible it is. The most common and preferred method is the excisional biopsy. In this procedure, a surgeon removes the entire lymph node through a small cut in the skin. This method provides a large tissue sample, which helps in making a precise diagnosis. If the lymph node is close to the skin's surface, the procedure can often be done under local anesthesia, meaning only the area is numbed. For deeper lymph nodes inside the chest or abdomen, doctors may use general anesthesia or sedation, and the tissue might be removed through minimally invasive techniques like laparoscopy or even open surgery. Sometimes, removing the whole lymph node isn't possible or necessary. In such cases, an incisional biopsy is performed, where only part of the lymph node or tumor is taken out. This method is less common but still useful for diagnosis. Another frequently used approach is the core needle biopsy. Here, a large hollow needle is inserted into the lymph node, often guided by ultrasound or other imaging tools, to extract small cylindrical tissue samples called cores. This method is minimally invasive, usually done with local anesthesia, and causes little discomfort. Multiple cores are often taken to ensure enough tissue is available for testing. In situations where a quick or less invasive test is needed, a fine needle aspiration may be performed. This involves using a very thin needle to withdraw cells or fluid from the lymph node. While it is less invasive, it may not always provide enough tissue to definitively diagnose lymphoma on its own. Sometimes, doctors also perform a bone marrow biopsy, especially if lymphoma is suspected to involve the bone marrow. This involves taking a small sample of bone marrow from the hip bone, using a needle to check for cancer cells. In some cases, doctors might collect fluid samples from areas like the chest or abdomen if lymphoma has spread there. For example, fluid from the chest cavity or the abdominal cavity can be tested. If there is concern that lymphoma has affected the central nervous system, a lumbar puncture or spinal tap may be done to examine cerebrospinal fluid for cancer cells. The choice of biopsy method depends on many factors, including the location of the abnormal tissue, the patient's overall health, and the amount of tissue needed for accurate diagnosis. Excisional biopsy is often preferred because it provides the most tissue for detailed examination, which is essential for identifying the specific subtype of lymphoma. When an excisional biopsy isn't feasible, doctors may opt for a core needle biopsy or other less invasive methods. During all these procedures, local anesthesia is used to numb the area, making the process more comfortable. For deeper or more complex biopsies, sedation or general anesthesia might be necessary. Once the tissue samples are collected, they are sent to specialized laboratories where pathologists analyze them carefully. They look for lymphoma cells, determine their type, and assess their characteristics. This detailed information helps doctors confirm the diagnosis and plan the most effective treatment. In summary, a lymphoma biopsy is a vital step in diagnosing lymphoma. It involves removing tissue from lymph nodes or other suspicious areas using various techniques, from needle biopsies to surgical removal. This process provides the necessary information to accurately identify the disease and guide treatment decisions. Always remember, if you or someone you know is undergoing testing, it is important to discuss all questions and concerns with healthcare professionals who can provide personalized advice based on individual circumstances.